And I've been in that role for about 4.5 years and got to work with a lot of different trans folks, their families, providers, and over the years have received a lot of questions, both from parents, doctors, and trans folks, all about fears, experiences, tricks for injecting, changes in their body, and a lot of asks for just a conversation around that from multiple perspectives. So I'm personally really excited to be able to offer this today and see how this conversation can grow in new relationships, and grow in how the community can rely on each other for our own expertise, as well as our medical providers working so kind of deeply entrenched in this community. So to get us started, we're gonna start with introductions. If everyone can introduce themselves, your pronouns, and your role in the community, however you wanna define that today.
Sure. My name's Alyssa Milliron. I use she, her pronouns. I am a physician and I work at Ample Health providing primary care for trans folks. So I'm really excited to be here. Thank you.
I'm Connor Wenzel. I use he, him pronouns, and I'm a community member and volunteer at Stonewall a lot.
I'm Whitney Dixon. I'm a gynecologist and a community member. I use she, her pronouns. I am an advocate for the community and provide gender-affirming hormones.
I'm Celeste Reinking. I use she, her pronouns. I work at Northern Valley Indian Health. I'm a family medicine physician, and I provide primary care and hormone treatment for trans folks, among other folks.
I'm Steph McCormick. I use she, they pronouns, and I'm a retired artist. I just do drawings and support everybody around me.
Thank you all for being here. And again, we'll have Silas joining in just a few minutes. We'll have them introduce themselves when they get here. To get us started, we've all used a word a couple times, gender-affirming care, gender-affirming hormones. I was curious if any of the doctors or multiple of the doctors here today would be willing to define for the audience and for folks watching, what exactly does the term mean, gender-affirming hormones, including the different ways that might come. I know we work with different age groups here, including the difference between gender-affirming hormones and puberty blockers. I don't know who feels excited to take that one.
I can talk about that. Gender-affirming hormones, for the most part, is a term used to refer to hormones that produce changes in the body to make the body either more masculine in terms of its presentation, or the body more feminine. So we're talking about testosterone and estrogen typically. It's less often that it would be used, that the term gender-affirming hormones would be used for puberty blockers. We usually refer to those separately, since puberty blockers don't cause changes in the body aside from just temporarily stopping puberty. So that's the distinction.
Awesome, thank you. Does anyone have anything they want to add? Cool. The first question for everyone here today is, what is your current relationship with gender-affirming hormones? Whether you're providing care, taking care, and whoever, maybe we want to start on the other side this time, if
Sure.
that's okay?
I started on hormones, oh gosh, it'll be 10 years ago in August. And when I very, very first started years ago, the doctor told me, he goes, it'll be 4 to 6 weeks and things will just make sense, and I can't tell you any more than that. And 6 weeks to the day I woke up and went, oh God, this is what he was talking about, because it was just, I had all this clarity, and it's hard to explain, but my brain was hardwired to receive estrogen, and so, things worked out a lot better. Plus, everything it just lined up the way it should, and so I felt well.
Thank you.
That to me is the definition of gender affirmation, is for somebody to not necessarily even need to experience the physical changes as much as the psychological changes. So I think that gets missed frequently in the conversation because people get so focused on, genitals and breasts, and in fact it has so much more to do with the psychology of gender affirmation. They're both important, is what I meant to say.
Absolutely. Yeah, I think we'll hear many different experiences, but that kind of relief or ability to breathe more freely or think more freely is a pretty common experience that folks find when they reach and are able to access the things that make them feel like themselves, or are able to be perceived by the world in a way that better matches how they understand themselves. Absolutely. Who else wants to go?
Everybody's looking back at me.
No, we're all just
Yeah.
Oh, go ahead.
I started testosterone in this community 11 some years ago. I kind of lose track, which is really good because then that just means that's how my brain wants to work. I was similar to Steph, but my response was really a lot faster. My analogy, because I do analogies a lot, my analogy is like a vehicle, a race car trying to run on regular gas, and so it was functioning, just not really great. And then you go ahead and put the jet fuel in instead, and the performance, not that I'm performing as a race car.
Oh, but you are.
But that, that's the difference, is like I was getting by, but it wasn't very well until I got testosterone. And our body it's affirming to see ourselves in the mirror physically, and people do focus on that. But right now, like the biggest thing and the biggest worries that the community has for getting access really is mental health, because we do live in a society that hyper focuses on physical, and we forget about the mental health that comes with blockers, so they can think about that, or with affirming hormones and whatever that is, and being able to align yourself better with the concept that you have in the mirror for yourself.
Thank you. Thanks for sharing. Silas, welcome.
Hi.
Thanks for being here.
Thank you for being accommodating of my lateness.
Of course, happy to have you. We're kind of just getting started. If you'd be willing to introduce yourself, your pronouns, your role in the community, whatever that looks like for you. And right now we're talking about the question of what your current relationship with gender-affirming hormones is.
Perfect. For my introduction, my name is Silas Zelny. I am a trans-masc, agender person, child of immigrants. I am a psychology master's research graduate, and currently my role in the community, aside from giving interpersonal friendship counsel to other trans friends and queer friends, is I'm also the admin analyst for a public health nonprofit, and I recently also joined the board for a BDSM nonprofit locally, so I wear a lot of hats and I have a lot of contexts, but all of it's around helping people and learning and talking.
Cool, thanks for being here.
Thank you. And my current role, relationship with gender-affirming care is finally and confidently stepping into a masculine presentation role without waffling or asking for anyone's permission about that.
Sweet. Any of the doctors you're willing to share a little bit about your relationship with gender-affirming care, how that's evolved, what that looks like for you now versus at the beginning?
Yeah, so I recently graduated as a doctor and come to the community about 2.5 years ago. And the reason I got into all of this actually is because my mom, Whitney Dixon, called me one day and said, hey, I just found out that basically we don't have enough providers who do this. I had a patient tell me, like, we don't have enough providers that do this, and I think it's something we could learn. And I was at the time training in Sacramento, and so we both kind of went on this journey of learning how to do this, which was wonderful. We big shout out to the Gender Health Center in Sacramento that taught me a lot. But really, I mean, I knew nothing, and I'm just so glad. I'm so glad that that we got this opportunity, because it's probably the most joyful part of my job, truthfully. I now have a clinic where I spend a whole day taking care of trans folks, and it's super fun. We have a great time, and I get to see a lot of trans joy there, so it's good. It's really, really good. And so, yeah, that's my relationship.
Well, and along those lines, that first patient that came to me was a teenager with their parent, and a very supportive parent, and I said, well, okay, yeah, I'll do it, but I don't know how, so I reached out to the gender health clinic in Sacramento. They were willing to let me come and spend the evening there in their clinic, go over their consents, their protocols, how they teach injections, so I didn't have to feel like I gotta figure this all out on my own. So that was a really great experience for me. And they were available for questions and hooked me up with a lot of the other resources in the community, so.
I'm sure Dr. Ranking's been doing this the longest out of any of us.
She's the most experienced.
The original.
I also was trained at the Gender Health Center in Sacramento. When I was in training, transgender care was not at all part of the teaching that we got in the institutions that we were trained in. So I was happy to be able to connect with a local nonprofit in Sacramento that was doing this type of work, and learned from them, and also from lots of other people too. One of the things that's interesting about gender-affirming care is that it's a really rapidly evolving and changing field. Hormones are interesting and have complex effects. Prescribing them isn't that complicated, but there is still a lot to learn about how to do it, and how to meet different people's needs with hormones. Whenever I go to conferences on transgender care, there's always a lot of brand new stuff and a lot of new thinking happening. So it's kind of an interesting field from a learning and medical perspective. And then one of the things that I've learned over the years too, as far as meeting the needs of my patients, is just that it's not like one size fits all. Gender-affirming care means taking care of and meeting the needs of the person in front of you, and it's not the same for, say, every trans masculine person doesn't necessarily want the same things. They don't have the same goals, and the same treatment isn't exactly always appropriate for each person. So, I mean, that's the case with treating patients in general, but you start from learning protocols like, oh, this is how much you start with, these are your doses, and then you evolve to kind of learning how to fit the needs of the people you work with.
I think there's really never been a better time to practice gender-affirming care too, because we used to, back when people were doing it and without really a lot of training or protocols in place, right? It was just people who learned from their patients, right? And it was just so unfortunate, because patients should not have to teach their doctors how to do this, right? But it really was how it was back in the day, right? And now we finally have gotten to a point where we have active research studies, and UCSF and UC Davis are doing studies to help trans people and to really get scientific data, because obviously that's what everyone deserves, right? Is to have, evidence-based care. And so, yeah, I feel like it's never been a better time.
Can I actually add to your point?
In California.
In California.
Yes.
The point I wanted to add was my graduate thesis was on the microaggressions that occur between trans clients and their clinicians, and how even small microaggressions can severely damage the trust a client has with their care providers, because not only do they need to be an expert in understanding who they are, which even for cisgender people, we can't define who we are in a simple sentence. We're complex people, we're organisms, we're not machines. And so to be able to be an expert in yourself, an expert in what you are to people who may or may not be accommodating or understanding, and then explaining how to get the healthcare you need to your provider is a very emotionally and mentally taxing situation to go through, and damages the trust the person has to give the provider and receive that affirming care, especially when they are the gatekeepers in achieving that care, to prove that they are trans enough to get the services they require to live the life that they would like to live. So having providers be knowledgeable and not using the client in front of them as the sole resource for knowledge is incredibly important. And that's much different than asking, so I know what the term transgender means, but for you, as my client, can you explain how you feel? That's a much different question than what is non-binary, what is transmasc? And that situation is very, very important for instilling and maintaining trust when you're providing care.
And I think even within the short amount of time I've been in my role, and the much longer journey of how to access gender affirming care in Butte County has changed drastically. Even just having a conversation around there is nuance, and each trans person is gonna have a different journey and want something different from their treatment. Everyone here who has ever taken hormones has all had a different journey, I can say confidently, and I think that's a really unique experience. And that piece, Silas, that I hear in that as well is kind of, we can already be starting kind of behind, right? There's a history of violence against trans folks in the medical community. If you add on other identities as well, whether you're a person of color, don't speak English, those barriers and ability to advocate for yourself and confidence in advocating for yourself in the medical field can totally feel very difficult and more or less successful. Along those lines a little bit, I was curious if folks would share what felt like one of the more intimidating or scary pieces when you first began pursuing or prescribing gender-affirming hormones. I know we've touched on pieces of that already.
Being the provider Silas is talking about.
Yeah.
Saying the wrong
Not
thing.
wanting to say the wrong thing, even unintentionally. I mean, obviously, if you're gonna be a jerk, you're a jerk. But if you're trying to be a good person, but you're inadvertently making errors, that's my biggest fear.
Yeah.
Is to be unintentionally cruel to somebody. So it's easier to say, oh, I don't really want to get involved, than to make yourself vulnerable. And so to say to my patients now, listen, if I do something wrong, you have to have a communication with me. I'm bound to do something wrong. So you're allowed to say to me, Whitney, don't say that. Here's the reason why. As long as, we're having a civil conversation about it, I am all about learning. And there are a million different variations of doctors, there's a million variations of patients.
Mm-hmm.
Trans patients are not that different than non-trans patients in that regard. So, but the term microaggressions is fearful for me, because I'm sure I do a lot of things that are microaggressive to everybody. And sometimes they are intentional, but to inadvertently hurt somebody who I am sincerely trying to help is my biggest fear.
Yeah, and I think that vulnerability is a big piece, and a lot of work and cultural shift we kind of aim towards is being able to make mistakes, being able to cause harm, and being able to talk about it without shutting down, right? So much harm just kind of spirals in our communities because of that fear of vulnerability, fear of mistakes, and largely fear of how to talk about mistakes when they do happen, which are, I think, talks like this, having more spaces to get access to some of this knowledge besides in the moment by moment interaction is huge, and I think makes providing gender affirming care even more accessible and a teensy bit less vulnerable than it used to be, right? As we have more conversations, studies, conferences, and that sort of thing. Anyone else want to add?
I would say that's probably the main answer, is that people are afraid initially to say the wrong thing, not understanding the language necessarily is a big part of learning how to do gender affirming care. But yeah, I've been really grateful that number one, my patients have taught me a lot, but number two, that they've just been so forgiving and understandable. You know, if you do make a mistake, and I guess if there's anything I teach students that are working with me is it's like it's not that we expect you to be perfect and to always get the pronouns right, and to, you know, we want you obviously to, but there are going to be mistakes, right? That this is part of doing what I do. It's how you respond to it that's really the most important part, right? And so I've just been really grateful that my patients have been so kind and have taught me and have been so forgiving when those mistakes do come up. So,
Thank you.
From the receiving side of it, I think the most difficult has been community access. I was really lucky to have one provider open a Saturday trans clinic, and went to see them, and they worked for a while, and I think I've had 4 different providers over the years, and the initial one, I didn't know what I was doing as far as like what to expect, and so I was relying on the doctor to do that, and so I was fortunate in that sense that I made the movement, you know, but what I did compared to the protocol today was vastly different. Like, I started on full dose, like, from the get-go, and it's just been access, because folks would get trained and they would move on, or they would no longer do it, and community-wise, this is the most providers that we've had in the community in the 11, 12 years that I've
Ever.
So it's been, and longest term. We'd get people trained in AMPLA and then they'd move. We'd get other folks and they'd move to LA, and so yeah, having that consistency.
Anything else on that question?
In the early days when I very first started, I didn't really have a clue what was going on. I met some trans people down south, and I just said, "Can I ask you questions?" And she was like, "Oh, sure, hon, what do you want to ask?" And I had all these questions, and so when I moved up here, I got a therapist, and he goes, "Well, let's explore that."
Yeah.
And we did, and he goes, "We'll find you some services." And of course, 10 years ago, we had like a person in town, and that was it. Thank you for coming. But I didn't have any vocabulary to go with anything, and so I kind of learned as I went along. Hormone part was easy. It goes, "Oh yeah, we'll just do some blood work and get your prescription," and I was off to the races. But as you get into it, you find out there's tons of layers to this, and it actually, after you get past the initial fear of unknown, then you can explore it and kind of have fun with it, really. It's like, well, what else new can we do today? What else can we try today? And it was kind of cool, because I didn't start transition till I was in my 50s, and so it's like, hey, second childhood, second puberty.
It's great.
You know, and I have to say, I've enjoyed the journey. You know, I had a couple bumps in the road, my T went up, this is not long ago. And I found out the brain changes were not fun. I said, oh, I remember thinking like this, I hated it. And once we got me leveled back out again, it's like, here comes all the happiness back. And that, I kind of enjoyed that, but it's been a learning experience. So.
Yes. To go back to what Dr. Whitney said, and I lost it, that the intimidating part for receiving care is absolutely not knowing if it's okay to correct your provider. So starting the conversation with the client of, hey, I please invite you to remind me if you ever catch me to slip up, is excellent to let people know in the beginning. I've had providers where outside in the social situations where I'm not going to be receiving services from this person, oh yeah, I can say, hey, excuse me, that's not my name. Excuse me, that's not my pronouns. But then when I'm getting services from someone, it's like, I don't want to damage this relationship and I don't want it to be awkward. How do I say, hey, you just got it wrong? So having that precursor in the invitation, completely relieves a lot of that stress. And that's so excellent. One of the other really intimidating things in the beginning is, I don't know if too many people think about it, but I'm a very psychology and life experience focused person. If you're trans and so you've experienced the life experiences of every step of the way, your entire life you've been told, no, you don't want to do that, no, you shouldn't do that, no, you don't feel that way, no, you shouldn't do that. How do you have the mental skill to say, we need to stop and I need to point this out? So that's a skill that I had to learn, and that was a really, really hard thing. The most intimidating thing for me was, the thing I've been told not to do my entire life of stop and say what I need to do everywhere now. That was the most intimidating portion for me.
I think I do want to talk about something that I think that some providers would find scary because it's an idea that's sort of out there that I hear from a lot of people, which is a fear that your transgender patient in front of you is going to change their mind about their transition. I think this is a big topic in the sense that it kind of looms large in some people's heads. And so when I tell my friends and acquaintances that I do transgender care, that's one of the first questions they come up with, like, oh, well, what about people who detransition? I have friends in the LGBTQ community who ask me that question, and they point out, that they know people who detransition, and it is a big fear for folks who are sort of contemplating that field. And it's a big fear for parents too. So parents coming in with teenagers, I would say that's their number one concern, is that they're allowing their adolescent child to access gender-affirming care or puberty blockers, but especially the gender-affirming care, and that their child will later change their mind and come to regret their transition. I have to say that while I've been sort of aware of this potential, the whole time I've been practicing, one of the things that helped me from the beginning was that the research in this field, we don't have as much research as we would like, but the research in this field historically has been that people, the vast majority of people do not change their minds about their transition. When you have folks who do, which is a tiny percentage, those folks get a lot of attention in the media, especially because they embody people's fears about hormone treatments. As with many areas in life, when you sort of make a policy decision, as a provider, my policy decision is going to be that I'm going to provide gender-affirming care to my patients. You acknowledge, you have to sort of carry that potential risk, right? Which is that you will help 99 people, and then one person you're going to help them for the next few years, and then maybe in 4 or 5 or 10 years they might come to think of their gender differently, and they might change their minds. I used to sort of find myself avoiding talking about that potential with patients when I was starting hormones with them, because I believed the research which showed that people by and large don't change their minds, right? But I've come to more recently really value the discussion of that fear, because especially when treating teenagers, the parents do have that fear, and it's really worth talking about openly. And second, I think all of us as humans, we do change in so many domains, not just as far as gender identity, but we change in terms of our careers and our relationships and our priorities, and in 5 years or 10 years we could be different in so many ways. So to not acknowledge that potential for regret, I think is doing someone a disservice, and I think it's worth having a discussion about it in a respectful way that acknowledges the where the person is in terms of their current gender identity, and not just saying like, well, are you going to change your mind, but approaching it from the standpoint of like, well, we have to acknowledge that this is a potential for anybody. Thank you. And providers kind of have to carry that like so many things we do, there's a risk to many things that we do, and this is just one of them.
Thank you for sharing that. And I think part of what I'm hearing that as well is we constantly are learning about people, patients, ourselves as we go, and thinking of gender less as a linear transformation, right? And I think even some of those adjustments, giving people the confidence, the tools, the knowledge to be able to say, okay, I don't have to go from A to B in order to be trans enough or to be happy, but there's, I gotta try a little bit over here, and if this is working for me, awesome. Or if I wanna shift a little bit, awesome. And having more open conversation around that, I think, is really great and supportive for the community. I know, for me, my journey as a non-binary trans person has been totally different in navigating that. My goal has never been from A to B. And so I think having those more open conversations and having providers who have the knowledge to talk about that a little bit more, with instead of just one goal, but maybe there's a whole, there's 10 different goals we can talk about here. Where are you trying to go? Really provides that supportive care. Which brings us into the next question. What have been some of the more positive and joyous moments of either receiving or providing gender-affirming care?
Well, I really like it when my patients come in telling me about their birthdays, like their, or their anniversaries with starting, I'll have patients who are like, I'm on month 3, or I'm on, month 9, or I just hit 1 year, and like, it's such a, they're sort of marking this obviously people don't change genders overnight, or transition their bodies overnight with hormones. It's a gradual process, but the anniversary of like starting that journey is like so significant to so many of my patients, and it's so wonderful to be able to be a part of it.
I love the first appointment where you teach people how to inject testosterone. It's really, my case manager and I, we live for it. It's the best. We have people bring in their families, if they want to celebrate, and it's very cool. It's very cool to be a part of it. I think in medicine, we unfortunately, we're taking care of sick people, right? And this is the one part of my life where I get to take care of healthy people and do something that is really positive and affirming for them. And so we're very lucky.
I like the first big step that they take, and they want to share it with you.
Yeah.
First time they come in a dress. The first time they come in with the new partner. It's the firsts that you're celebrating with them.
First hair.
Yeah, let me show you my goatee. Yeah.
Yeah, those are
Doc,
great.
I know I'm supposed to keep my mask on, but I really want to show you my facial hair. Go ahead. Show me. Yeah.
Can you tell a change in my voice?
Yes.
First post-op visits are actually also very exciting. It's the firsts.
Yeah.
Celebrating the firsts.
Yeah.
Absolutely.
It's funny how you remember that date too. It's like, I paid attention to when I had my appointment, and then a year later, it was like, oh, it's been a year ago today. And I kept celebrating that every year, and so finally I said, well, I guess that's my birthday. So I called it that.
That's great.
Definitely recent joyous moment actually for me is using the men's locker room for the first time. Going in and like, no big deal, no nothing. You don't realize how like eyes down men are in the locker room. Like, they didn't even notice I existed. It was so nice. And like, I think the joyous moment is telling friends and other people in my life, like, yeah, I did it, look, we did it. And they were like, yeah, because you're a dude and you look like a dude, you ought to be using that locker room. But when you look at your own face in the mirror, day by day, you don't see that big change, and then you look at a photo from like 2 years ago and you're like, who is that? So definitely really digesting and feeling that moment of, yeah, I do look different to people. That's an incredibly joyous moment.
Thank you.
And it's mirroring everybody's, there's just a lot of, probably the best way to sum it up is, I finally found myself, and I get to see it. So that's like the most joyful thing, and sharing it we don't think about cisgender people having puberty, that they have those excitements, but it's normalized, and so it's not a big deal. Kids still do, like, oh look, I got a hair, I got a mustache, can you see it? And they do that, but everybody's doing it in a similar time frame, and so they get to see each other. And so when you do it, yeah, it's a big deal, because you went through the first one that didn't work, and seeing yourself day by day and feeling yourself is big.
Awesome, thanks for sharing that.
One more.
Please.
So I'm classically trained OBGYN, and when I decided to do gender-affirming care, it said gynecology and women's health on my door, and I didn't really know what to do about that. And when I was at actually an unrelated laser training conference in Texas, the very Texan person doing the training said, you should change your name to sexual health instead of women's health. And I was like, I'm gonna do that. So changing my door was a big deal to me. Yeah, it was just something for me, and nobody else ever said anything to me about it. It was my statement. Like, I don't take care of women,
Yeah.
I take care of people.
Thanks for sharing that. I think that's big. I think a lot of folks I've talked to, and my own experience, those initial moments when anyone enters a space, whether it's the doctor's office or the county's office or wherever we're trying to access the things we want and need, those first moments, those first interactions can really be large make or break moments, especially folks who've experienced violence or not been supported by traditional systems. There's a constant analysis. Am I gonna be safe here? Can I belong here? Will they understand me? Will they try to understand me? And I think, a lot of those little shifts in the waiting room, in language, in brochures, in the pictures on the wall can really help kind of signify to folks, hey, you'll be understood here, you'll be safe here, or at least I'm gonna try my darndest. So I think that's a really great example of that. Thank you for sharing that.
I will say it was kind of fun going into your office for pap smear, and other people were like, so yeah, that was fun, just because it makes people think.
And when we had our first learning together experiences, I said, do you want the first appointment in the morning or late in the afternoon? You're like, nope, this is good for everybody.
That's awesome.
And it was a positive experience. Front office is also a barrier, like Silas was talking about. Do I belong here? And if the first person you come to misgenders you, or there's not space for you to tell them what your name is, and they just read, those are like, I don't belong here because they're not seeing me. And am I safe here because I'm getting care from somebody that I don't know if they're just ignorant or untrained or they're intentionally doing this. And so those are big questions that come up for people.
For folks here specifically who have accessed gender-affirming care, is there anything you would really want providers to know, whether about the barriers you experience accessing it, or anything you'd really want to make sure that doctors, providers, nurses listening today would hear from you all specifically? Forms.
It sounds silly, but when you only have a male and a female box to check, and federal government, Medicare still doesn't get it. You have to be one or the other. It was like, well, but I'm not. I had a heck of a time getting a mammogram approved, because it had to be, if you're female, it's just screening. But if you're male, it's gotta be diagnostic. And if you're gendered wrong by your what do you call it, insurance, you're kind of screwed, because I'm stuck in the middle, you know, and that's not fun.
Yeah, that could be a huge barrier.
It's getting it all done, I'm getting it all done, but it's still, a little maddening at times.
Yeah.
You know, have that drop-down box that says, okay, how do you identify?
Mhm.
And then, I love the place I go to, because they're very, very respectful. Everybody calls me by my name, uses proper pronouns, it's all good. But I can see where it can go wrong real quick, because I live in Oroville, so I get my services at the Oroville Hospital, and I get as many questions from the staff, which is okay, I'm good with it, but a lot of them, the lady that did the mammogram had never done a trans one before. And she goes, oh, well, how's this work? You know, and she's asking me all these questions, and I don't mind answering. But it's kind of nice, you know, when people get it right from the beginning.
Totally. Thanks for sharing that.
I agree, definitely forms, the software you use for charting, having those options to be able to be customizable to your client is really important. For example, when I go get my reproductive health with Planned Parenthood, their charting system always asks, are you currently breastfeeding? And every time I say, well, I had those removed, so I don't see how. Can you maybe mark that to not ask that question in the future, because how the heck would I do that? I had them removed. But their charting software, like, it will ask every single time, no matter what. And that can be a barrier to the client and clinician relationship. So being able to customize the charting software, the forms, asking about the parts you need, not what is your gender, male or female. Like, why? Do you need to know if I have breasts? Do you need to know if I have a penis? Do you need to know what parts of me you need to check for diagnostic or regular checkups? You can ask what organs and parts I have, sure. And then the gender identity is completely separate. Having those options, one, can be more affirming for transgender people, and also for the intersex community and cisgender people as well. They have different experiences. And so being more accommodating for trans people really, in my opinion, expands care for cisgender and anyone as well.
I think one.
You
Sorry,
might
just-
think that's easy.
Oh no,
It's incredibly difficult.
Mhm.
So you
The
know,
software
the
changing
software
stuff is so hard,
really
yes.
hard.
And in that, I know, like at Chico State, yeah, the forms is always seems to be the biggest barrier, aside from providers, having providers to go to fill out forms. You know, but like Chico State's software, they didn't realize that there was like a little go into the program and unclick a box, and all of a sudden there was, you know, the preferred name option showed up. And so it's like knowing what the possibilities are within that software. And yeah, I mean, it's just the difficulty voicing that also, especially when you start, because you don't realize how much stuff has those barriers. My first pap smear on the phone with insurance, like, I know it says M, and I need this, you know, I do need that, I have it, so I need it. And, you know, I think that went on for like four different appointments, so over the course of 2 years of, yeah, I need this, and them finally getting it right. And so it's not just doctor's offices, it's you know, other systems, Medi-Cal, Medicaid, having that, and knowing, you know, and having conversations with how are you coding this, but you, especially if you're a teenager and or a parent, you don't know that this is needed to, you know, you have doctors when they first start don't know that it's needed. And I know there has been questions of like, I'm I'm not sure how I'm gonna chart this and code this for insurance. And yeah, there's been people like, are you comfortable if I mark this box? And yeah, totally good. But it's the front line barriers that are the most challenged.
Totally, and I think with the different medical clinics, whether it's been the hospital or individual providers, I've worked with a lot of what we talk about is, yeah, those electronic medical health systems are difficult to change. County forms are difficult to change, and you know, as individual people, we have power over paper, right? The language we use, we don't always have the ideal facilities, the ideal forms or systems, but how do we talk about that as the person kind of in charge of navigating those barriers and navigating that access? You know, if it's, hey, I only have these limited options in my system, how would you like me to call you? And I have to go through these questions. You can help choose which boxes, you know, given our options, or these are the only bathrooms we have. Between these, where do you feel safest? Being real and knowing that we don't always have the perfect answers. We're far from having perfect systems. And how do we individualize those experiences to acknowledge that and kind of be specific and transparent with that? And I've seen interesting tricks that different clinics have come up with, and Lowe's changed some of their charting systems to kind of have someone's current gender and name more up front. I've seen some clinics just choose as a clinic, this field we never use in our charting forms, we're gonna know that all staff knows to look there for pronouns, just because it's a field we don't use, or other.
And have it highlighted so that they see it when they actually look at it.
At the Social Security office, I kept getting Medicare cards with my dead name. And so finally I went into the office and I said, can you fix this? And this nice lady goes, I don't know, let's see. And she goes through the computer and all of a sudden she goes, oh, somebody didn't know to hit this button and open this screen, and all this hasn't been changed. But you have to know it's there before you can do it. And so she changed it all for me. I got my card in the mail and life's good. But yeah, you gotta train your people too once it's in place.
In agreement with all of that, and then also with what Dr. Whitney said as well. Because for my job, I'm currently adjusting our charting software for what we do. It is very hard when the base programming for the software does not accommodate that change. Something that clinicians and different organizations who work with charting software can do though is continuously bug the developers, continuously say, no, this is a need we have. I won't say the name of the program we use, but the one we are using. I sent them an email explaining why, if we are going to give non-discriminative care to everyone, we need to accommodate everyone. It doesn't include our other populations if we don't have these ability to mark pronouns, ability to mark gender, or if we can mark gender, it's only to say, oh, they're other than male or female. That's a problem. That shows your clients that, oh, so am I considered other here? And so essentially being annoying and making a stink about it until the clinicians and the clients who say, hey, this is something we need, finally the people who aren't involved with clients at all and only work on the charting software can say, okay, fine, we'll do it. But I think that's definitely maybe the next step of this healthcare conversation is compliance and forms, not just the client-facing behaviors, but also the software.
I want to take a minute, thank you all for sharing, and I want to take a little bit of time to dive into kind of the logistics of of taking hormones, whether that's been injection, gels, pills, how that's changed for you. And I'm curious for everyone here, both providers and folks who've been using hormones, do you have any tricks to share with the rest of the trans community, with the rest of providers around ways to inject more safely or more comfortably, or how you've changed from injections to other ways of hormones, and what that's looked like for you? Do you have any advice or tricks that you've learned?
I know for myself, I've injected the whole time, but I started intramuscular in my thigh, and I have a muscle spasm situation with my body, so I was noticing that I kept hitting like trigger points, and so my leg would be really sore all week, and then I'd have to go and do the other thigh. And so a mentor mentioned subcutaneous has been, you know, looked at, and so that was developed within the time frame that I had started, so I switched to subcutaneous, smaller needle by the belly button. I occasionally get a little bruising, but it's much better than the sore thighs, like I mountain climbed and I did.
Just to define for a moment, subcutaneous would be an injection just below the skin versus another form of injection is intermuscular, which is a longer needle to inject directly into your muscle.
Much more intimidating looking needle too. And I was doing sub-Q injections for a long time myself. For a while I was microdosing testosterone to have a slow transition, because I wasn't sure where I wanted to be on the, when people viewed me, I didn't know how masculine or feminine I wanted to look yet, but I knew I wanted to look more masculine in general. So I went with sub-Q for a while, but the life functionality thing for me was, with as bad as my ADHD was, especially during the lockdown, if there were too many steps, it wasn't gonna happen. And that was not for a lack of desire and wanting it to happen, that's simply of, my brain's different, and I'm not on my ADHD meds, so I can't do anything that is arduous. That's just not how my ADHD works. So switching to gel for me was really, really helpful, because for my daily schedule of life, it really seamlessly fit into my day-to-day. I could adhere to my medication very well, and it worked really well for my lifestyle and my limitations with my mental ability. So considering those changes too are really important for folks to be able to be really regular with their dosing.
I've been kind of through the whole gamut. I started out with creams, and you know, you apply those a couple times a day. Transition was really, really slow, and I asked about it. I said, is there any way we can kind of speed this up a little bit? So then all of a sudden now I got trained how to self-inject, did the injections for a few years, and then you know, you keep hitting the same spot, like Connor said, every time, and my skin got like rhino hide, you know, real fine gauge needle, and I push and push and push and push, and all it would do is dent, until finally it went pop and went through. And so I switched off of that to patches. Patches weren't quite enough, even wearing a couple of them, and changed them a little more often, so we went with the sublingual and patches. So I've kind of done a lot of the different ways, and this one seems to be working the best, and I don't have to stick myself every week. I don't miss that. I've never been good with needles. I would set it all up and get it ready and then look away while I was doing it.
Oh, good.
It's just, you know, and yeah, anyway.
Providers?
I think the only little trick that probably a lot of folks know, but sometimes when I've had patients who transferred their care to me, I found they were just using one needle for pulling up their medicine into the syringe, and the same needle for injecting. And just putting that needle into the vial dulls it. So it's good to switch needles to have a nice sharp new needle for your injection. That's going to make it go in easier.
Sounds scarier, but it's actually much better.
Yeah.
Yeah. Yeah, more injuries with a dull knife than a sharp knife.
One more thing I wanted to add too, for people who may have mobility issues or other related issues, looking into how folks with disabilities can administer their medications can also be really helpful for trans folks, especially with needle anxiety. I know there are devices that you can press a button and the shot goes in, and it's a lot easier because you don't have to look at the whole setup that a friend of mine uses. There are many accommodations for the disabled community that really translate well to the trans community, and especially when there's intimidation and anxiety around applying your medication. Whether or not it's anxiety around, oh gosh, did I do it right? Did I ruin my whole transition? For the folks just starting, that I absolutely felt too. It really helps reduce those what ifs and the, oh God, I gotta wait till next week till I talk to my doctor about this. I hope I didn't screw everything up. Just to have a tool to help you know, okay, I used my tool, I have this thing to help me out. I don't need to freak out till next week. We gotta figure it out. Can really help people feel more confident in their care.
A little off topic, but for anyone who's having issues getting their needles covered, I take care of a lot of patients who are on managed Medi-Cal plans, and we, from the beginning of last year, all of a sudden had this huge issue where they would give you the vial of testosterone, but then they would ask for money when you walked up to the counter for your needles, which makes no sense. Like, we would never prescribe insulin and somebody wouldn't have to necessarily pay for their needles for that, right? It was kind of a glitch in their system. Please talk to your provider. There are ways for us to order them that I think are getting covered now, but it took us a long time to figure them out because there was no guide on it. We had to keep trying things until something got covered, but we certainly don't want people getting the wrong needles or injecting themselves with bigger, longer needles than they're supposed to. I can't tell you the number of times I've had patients come to my office because they were having pain with the subcutaneous injections, which really are supposed to be done with like a 5/8 needle. We're talking like a tiny needle, and they would show me what they were using, and some pharmacist had given them like a 1-inch needle. I'm like, okay, well, you're putting that into your abdomen, that's why it hurts so much, right? That's not, it's supposed to go into the fat under the skin. So if you are having problems getting your needles covered, or if you don't think you're getting the right ones, please talk to us, because we don't want you to be in pain. It's not supposed to be painful.
I like the trick of bringing your needles and syringes to the doctor's office, because quite often people are given things that I did not prescribe them.
Yes.
And there can be issues with not, sometimes people have a hard time figuring out how much to give, and we do a training, but it's always good to sort of refresh. Sometimes people kind of forget, and it's nice to make sure that we are on the same page as far as how much you're injecting.
Specifically around the needles discussion, I know I've worked with some trans folks who do absolutely have that barrier, and as that's getting navigated, Learn Valley Harm Reduction Coalition also has syringes for trans folks accessing hormones, and also can help with some of that training, and also disposal. I've had a lot of folks say, I have no idea what to do with all these needles I just used, or I feel scared to put them in my car or to bring them into public places where I can safely dispose because just fear of judgment or outing. And so there are resources around that. Stonewall can be a tool. We help people access safe disposal as well as MDHRC.
Facilitating the trans group, we've had conversations about nobody's mentioned progesterone, and that, that's a personal choice. I've had folks that share that they love that week of off estrogen. It feels like a natural cycle. Their brain works really well with it. And I've also had people say that they have nightmares and can't sleep and start thinking about suicide when they're on that. And so it's like advocating for what feels right for your brain. If you're not feeling, like Steph mentioned, not knowing that the levels, because the brain just wasn't working the same way as what you want. But if there's factors going on, that's a conversation that you need to have. Like, I'm still scattered, or I don't like this doesn't feel good, or testosterone blockers, some people want them, some people it doesn't work for them. And so you do have to self-advocate in the way of how you feel, and have that and share that. You can't be afraid to share how you're feeling with your provider, because that's the only way that they're going to know whether it's working for you or not, and what are you going to need to adjust or not. And being aware that the world that we live in, there's lots of layers that we've done for self-protecting prior to transition, and so it's not a magic pill. You don't solve all of your mental health problems or difficulties just with just hormones, that lessens the barrier, and things are gonna come up. And you're gonna have to start working on some of that stuff in the process of unpeeling the onion, like we say, because that's what it is. And then talking to the providers as that comes up, and you know, whether they recommend a counselor or whether you really feel like you need it to see a counselor or have space to share so you don't feel like you're alone, is also something that through this you need to be thinking about.
I want to close us out with kind of, in terms of our prepared questions, unless there's other questions in the audience, with kind of doing a full round of how has gender-affirming care impacted your life, and if there's anything else you wanted to share to make sure the audience heard today. Anyone feel called to start?
I can. Yeah. You live your entire life one way. People perceive you the way they perceive you. And then all of a sudden you say, you know, I'm going to change all this. A few people are good with it. A few people are okay with it. And there was, for me personally, a whole lot of people said no. And the doors quietly closed. And I don't have any contact with any of my family anymore, other than my dad, who's in his 90s. However, this community, especially the Stonewall community, it was just like another family popped up and said, well, we'll be your family. And I said, okay. So you have to kind of be good with that. It's hard to mourn the living. But at the same time, my own personal perception is, wow, are you people missing out on a really cool person now? Because I'm way happier, way more contented. You know, everybody gets angry, and I still get angry, but I don't fly off the handle and go into big rages or any of that stuff anymore. I'm a lot calmer person. I have a meditation practice that works really well for me. And, you know, things are good. The only thing I'm running into recently, previews, is focus. I want to try so many different things. I can't stay focused on one for very long at all. But yeah, be prepared for some huge changes.
Thank you, Steph, for sharing that. Well, let's go next.
I can go next. And like for context, when I first started my transition, I was so scared of losing my partner at the time that I really curtailed my transition to what he was willing to accept of me at the time, because we were very enmeshed, and you know, that's just how life is sometimes. So I went with, yeah, I'm non-binary and I'll just look a little masked, but not too masked because my boyfriend's straight. And that sucked. So definitely learning that and really living it, mentally understanding that your transition is for you alone. And once I started transitioning with that in mind, I like stopped my microdosing for about a year, rethought, like collected myself, went off testosterone to really think, what do I want out of this for me alone now that I'm single? And it was, I just want to be a gay dude so bad. And once I started doing that, very similarly to what you said, I'm calmer, I'm happier, and it's not that I don't have bad days or that things aren't hard, because I was doing my master's during that, and yeah, things were hard, yeah, I cried, things sucked, but one issue wasn't, oh, and at the core of who I am, I feel trapped. That was not an issue anymore, and suddenly I could be more upfront about how I felt and my emotional conflicts and my interpersonal connections. And I actually, for me, transitioning and really putting my foot down about my identity helped me reconnect with my dad. My dad is like the kind of person who doesn't appreciate people who waffle and can't stand up for what they say. And so I never really came out to him before, but recently I reconnected with him and said, so I'm your son Silas now, that's my name. I'm a guy, I use the men's restroom, I use the men's locker room, I'm growing facial hair, although I'm Asian, so we'll see how that goes. But he was like, okay, so you're telling me who you are and really saying it. I get that better. And his only thing about that was, I'm scared your life is gonna be hard. And what I said during that dinner meeting we had was, life may be hard. It was a lot harder when I was presenting as cis and things were supposed to be easier, but I hated myself. If life's gonna be hard, at least I really, truly love myself and I'm really happy with myself. And my dad was like, okay, that makes sense. And then that was it. So for me personally, being very, very clear and decisive about who I am opened doors for me. It did pause some, but also I'm very aware of who's worth having around in my life versus not. And so I don't doubt that anymore. I don't doubt why people like me for, if it's because they interpret me as something I'm not, because I look like who I am now.
Thank you.
Probably the similar lines. I tend to be a pleaser, and so I would do everything I could to kindness to somebody in order for them to acknowledge and like me, because I didn't like myself without realizing it. And so pulling that layer off, I'm definitely more confident and more outspoken. I still don't like conflict. I don't know if anybody does. But I get to be part of a tribe with a lot of people. Everybody has little tribes, and I get to be part of their tribe and part of their tribe, and it feels really good to be authentic in that space and people want to come and have conversations with me, and I can also be more confident about sharing the information that I have and others' shared experiences. It's just worked. Yeah, my brain is just so much clearer, and I'm not having to look up, through 5 feet of water and in order to try and see myself, because you really can't see the picture when you're down there. And so yeah, it's up and it's clear, and
as a cisgender physician, I am just continually honored and privileged to be able to provide this kind of care and to be trusted with really a very personal thing that your patients are bringing to you. I think that doing this kind of care has made me a better physician and a better human in general, and so I'm just really grateful that I get to be a part of it. So,
Thank you.
For me, it's fun because I get to do it with my daughter, so when we have questions, we call each other. She does the internal medicine, obviously a lot more than I do, and I do the gynecology more than she does, so we get to bring together 2 different medical fields with a common goal. So that's fun for me. And I got to meet Celeste, and all of you guys. Yeah.
I'll just echo what Alyssa said. I think this is a really rewarding area to work in and to meet wonderful patients.
Thank you all so much for being here. I appreciate and respect all of your time and just having these dialogues, and I hope that these sort of conversations can grow. I want to see if there's any questions from the audience. Yeah.
Lauren, I just think my voice is not on the camera. Maybe you can repeat the question afterwards.
Perfect.
I'm just gonna turn it off.
Yeah, that's good.